In the United States, California has taken the lead in flattening the COVID curve, and the Bay Area, home to the country's largest technology companies, is in the forefront of this fight. Silicon Valley took the bull by the horns by putting in place some of the toughest social distancing measures we have seen in our lifetimes, upending everything we knew as routine. While many of us are privileged to work from home, our healthcare workers are on a war footing. Hundreds of thousands in the Bay Area alone have lost their jobs. Schools are out for the rest of the school year. Parents, teachers, caregivers, our children, essential services workers, all of us are on a new learning curve, figuring out our new normal. Yet, in this COVID world, technology is emerging as a superglue that holds our world together. So, what is your new normal? How is technology rising up to the challenge? How are you coping? How is our government coping? Where do we stand in this crisis? Hi, I'm your host Archita, a techie, a filmmaker, and a mom of two. I'm bringing on board a few experts to talk about the pandemic, its effects, and how we're all coping with it. Let's get to the heart of it, right here, right now. Stanford is front and center in combating COVID, be it care, developing tests, and research. My first guest on the show is Dr. ANURAG MAIRAL, an adjunct professor of medicine, director of global outreach program at Stanford's Byers Center for Biodesign. He's also an adjunct professor at the Stanford Graduate School of Business. In these roles, he leads initiatives focused on applying biodesign process to resource-constrained settings globally. Welcome to the show, Anurag. Tell us about your involvement with the COVID-19 crisis at Stanford University.
Yeah, this crisis has been really challenging us for all of us, not just at Stanford but worldwide, and I think all of us are playing the role that we potentially can. As a member of the global health leadership team at Stanford, my role really is focused on technology innovation and impact. So I've been part of conversations around what role we could play in terms of innovative technologies and bringing them to the patients and the critical care setting as quickly as we can. So in addition to those conversations, there are two specific things that I wanted to mention that I've been involved in. Number one is a remarkable site that brings together curated, really high quality information in light of all of the flood of information that we're getting and everybody's getting so stressed out about it. This platform really strives to bring as easy to use and as thoroughly researched and curated information as possible. It's called COVIDDB, covidb.org. And I'm working with a number of Stanford students and faculty members both inside Stanford and outside. Dr. Pia Sarkar is one of the leaders in this effort, and really been a joy to sort of be part of that initiative and contribute to that. So that's one. The other one is there are a lot of students at Stanford who are working on innovative approaches to addressing this crisis, both from tracking and monitoring the patient population to serving the underserved and the vulnerable, through various means. And I've been advising a number of these students on the needs part of it, which is one of the things that we do at Stanford Biodesign. We are a very needs-focused, needs-driven innovation organization. We teach that as part of our program, and I've been advising a number of student teams on that. There are a number of things that these students are working on, from medical devices like ventilators and things like that, to 3D printed materials, protective screens and protective shields and masks and things like that, but also going further beyond that.
Tell us a little bit about the strategies that California has adopted versus New York. I mean, we see a little bit of difference in the way how it's panning out for both. What are your thoughts on that?
Yeah, I think one thing that we have learned from the global experience, starting with China, but as it sort of moved from China to westward, the thing that we have realized is that stopping public movement and creating social distancing has been fairly effective. And the sooner you do it, the more effective it is. The more complete you are, the more effective you are. So that's something that we did in the Bay Area. In fact, even before the entire state declared shelter in place, the Bay Area counties and the health officials in the Bay Area counties took a bold step, first ever in the entire country, to really stop the movement of folks and mingling of the folks by saying shelter in place. All the essential services were still open, but communities basically came to a complete standstill, and a lot of folks said that was a little too aggressive or a little too extreme. But I think it was a really effective move. And right after that, California, the Governor Newsom actually declared a similar sort of guidance for the entire state of California. And that happened at least a week before any other state, in many cases, several weeks before. And you start to see the difference of the difference that has made. I think a big part of, there are a number of other reasons also why New York is suffering more. But definitely our shelter-in-place order coming as early as it did really did play a significant role, in my opinion.
And we're hearing a lot about herd immunity right now, and how California has gotten before, so therefore we have 30% herd immunity. And then the UK was considering that over a lockdown, and then they changed their strategies. So can you comment a little bit about that? What's with herd immunity and what's going on right now?
Yeah, that's a great question. And I think there is some merit to the concept of herd immunity, and it does make sense to actually ultimately build that herd immunity. The challenge with COVID-19 is it's a new coronavirus. It's not the coronavirus that we have been exposed to before, so we don't have a vaccine that's effective against it. And that vaccine is at least 12 to 18 months. I would say 18 months is my bet, but at the very least 12 months away. Which means that we can't protect our population against this disease through vaccination. All we are doing with our flattening of the curve, the social distancing, staying at home, is really delaying that exposure. But everybody who's not being exposed to this disease, this virus, is susceptible to the disease. So anytime we open up our markets again, our communities again, if they are exposed, if they come in contact with anybody who's got that disease, they're likely to get infected, right? They have a high likelihood of them getting infected. So if that's the case, then question somebody can ask is, if that's going to happen anyway, and the vaccine is 18 months away, why not just expose everybody to this virus and create herd immunity, which usually means immunity of the herd, by letting individuals build those antibodies by getting exposed to it. The problem is that theory is that we don't really know how to manage this disease at a population level yet. I already talked about the limited infrastructure that we have in each of our regions. Our number of ventilators, number of ICU beds they're limited. So if you suddenly have an entire community of 1,000, 10,000, 1 million people that are exposed to this virus and have this disease, while they may be quote unquote building the immunity, they may actually go through some very significant, at least a number of them will go through significant effects, sequelae, clinical sequelae, as a result of that exposure, which means many of them will die. So the question is, in the effort to build that herd immunity, are we willing to sacrifice a certain number of people, especially the people who are vulnerable, who have comorbidities, other kinds of diseases, underlying conditions, old people who are underserved, who have other, people who are immune compromised. So are we willing to compromise or put at stake the lives of those vulnerable parts of our populations? I think the answer is probably no, because in healthcare, we don't usually do that. So I think that there's a flaw in that herd immunity approach, in my opinion. I think what we are doing right now, even though it's a lot of economic hardship for several people, a number of people, I think delaying, or flattening the curve, deferring the exposure is probably a better way until the vaccines are here, until the viral sort of loading in the community, or the number of people who are infected, a number of people who are getting hospitalized, number of people who need ICUs, until that rate starts to come down. So I think it's going to be, I liken it to tap, where we open the tap, a little bit of water in before it floods, and then we close the tap, then we open it again. It's probably going to be that way, far more measured, far more managed and controlled. So it's still creating herd immunity to a certain extent, but not really exposing everybody in one fell swoop.
And what can you tell us about policies in terms of, is centralized approach better than state-wise policies in play with regards to COVID-19 crisis?
I think, sure. I think we do need, in fact, I would say we need a global approach to this. So there are two parts to, that's a great question, by the way. There are two parts to my answer. One part is really about how do we approach this at an architectural level, at the highest possible level. This disease affects everybody in the world right now. There are more countries, if my math is correct, there are more countries impacted by COVID-19 than there are members of UN. Of the UN. It's one of the most widespread disease outbreak that we have ever had in terms of the number of countries, and it's not just a healthcare crisis. It's actually a societal crisis that we have. The social isolation that we are facing, the economic shutdown, which is impacting a lot of people beyond people who are getting the disease. So it's a really significant problem globally. What that means is that the solution has to have a strong global component. Countries have to work together. WHO has to be involved deeply. The leadership in every country has to work with the leadership in other countries, so that we can have a more global architecture to solving this problem. And I'll come to that in a second. Come back to that in a second. We do need a more local implementation of these approaches, though. So, for example, what happened in the Bay Area with the shelter in place was a really critical move, and I think we need a lot of local leadership. So they might be global guidelines, global sort of thought leadership on it, but unless the local leadership really takes it upon themselves, it just is not going to be effective. So we do need a local implementation and local leadership in tackling this problem. There's something else to keep in mind, that if we do the social distancing here, and there are parts of the U.S. that don't do social distancing, at some point when we start to see our death rates come down, and we start to see the infections rate come down, we start to open up. The other parts of the country that didn't really follow that have a large number of people who are not infected, if there's a exchange of people between those two regions, now suddenly the population here is exposed. So unless the local regions, local communities don't take decisive, bold action to protect their own communities, but also understand their responsibility towards rest of the country and rest of the world, we will not really defeat this really significant public health enemy that we are encountering.
What about predictions in terms of trajectory of this disease? And I know that there's not enough data out there. This is a novel virus, but we're talking about a peak period, and then the tail period, and then the long tail. And do we have any information on how this is going to be a predictable path or not?
Again, no, I don't think we can predict it yet, but one thing that we do know is this virus does not mutate as fast as our regular flu virus. So that's a good piece of news in some way, because what that means is if we do end up coming up with a vaccine for it 18 months from now, I mean, there are a number of molecules that are at least 7 that I know of, and I would say over 10 molecules that I've heard of, but 7 that are moving along pretty rapidly. Whenever there is a vaccine, that vaccine may have efficacy for a longer duration. So even if there is a seasonality to this virus, which we don't know whether it does or not, whenever it does come back, if somebody's vaccinated, they might have some residual immunity to this virus. So that's a good piece of news, actually, versus flu, where we need a new shot every time. So that's one piece. The second part is that because there's no vaccine right now, it won't be there for next 18 months. It's likely that in a few months, this virus may rear its head again in the communities that have been impacted by it. Because if 100% of us don't have antibodies for it, and we have not been exposed to it because of social distancing, which has its own downside as well, right? Then what that means is those folks that have not been exposed are still at risk, right? So when the virus comes back, you will see an increase in number of cases again, an increasing number of deaths again. But my hope is we would have learned so much from our first round of exposure and experience with this virus that we are a lot more prepared in terms of our infrastructure, in terms of our protocols, in terms of our own behavior, that the numbers are going to be much lower. So the flattening of the curve that we talked about, I think the flat curve would be flattered in that second wave if it does come before the vaccine is here. And it's, we are seeing that, right? I mean, in Japan, there was some initial, mini surge there about 2 months back. And now we are starting to see emergency shutdown in various cities in Japan. China, we are seeing some of the regions saying that there are some new cases there. So my feeling is that we'll need to be vigilant, and we should be mentally prepared for a second wave. So there would be a tail to it. And so, for example, they're saying that there's a peak that we are expecting here in coming couple of weeks here in California. But as we start to come down on our death rates and our hospitalization rates, the tail is going to be long, because we haven't build a herd immunity or immunity amongst all of us. So we'll continue to see the cases, and they will continue to so whatever we are doing right now, we may not, even if the market's open, and even if the shops open, and the bars and restaurants open, we really have to have a different set of behaviors to prevent the second wave, if it comes to from being very significant or serious.
This is something that's been on my mind a lot, and I'm sure for a lot of others as well. What does the post-COVID world look like to you?
Yeah, that's a great question. This is, in my opinion, this is, just looking back at the history of various epidemics and various calamities that have befallen our civilization, our country, our world. I think this is, first in 100 years, after 100 years, that we're seeing this. World War II impacted, it was a world war and it impacted a lot of people, but it evolved in a different timeline, and the nature of impact on different communities was very different. This is fairly significant. It's in a modern world that is known to be very, world that has become really small. We travel so much. There's a lot of mobility across continents, across countries. I think it is making us all rethink, what is our society really all about? What are the things that are absolutely critical for our society, things that we must value versus things that we shouldn't? So that's more on a philosophical level. But in terms of our economy, in terms of our industry, in terms of how we approach education, how we approach healthcare delivery, how we approach, manufacturing, I think a lot of these, how do we approach our supply chain? A lot of these things are going through a major rethink, and I advise a number of companies in healthcare space, and the conversations that I'm having with leaders of these companies is very much about how do they make themselves robust in light of this crisis, and how do they make themselves resilient and nimble. So I think we will see probably a lot of distributed healthcare, for example, a lot of care that will be moving closer to home. There's an inverse U-shaped curve to healthcare that we have seen evolving over the last couple of decades anyway. In 30s, 40s, 50s, most of the care was provided near your home or at home. A doctor may come to your home, actually. In many of the countries, they still do, I guess. And then in 70s, 80s, 90s, we had these tremendous technologies that came that required us to build these big hospitals. A lot of people started moving to hospitals for the care that they sought, even for some of the simple things that we did. But then we've last 10 years or so, thanks to technologies and so on, a lot of care has been moved to clinics near homes. And over the last few years, telemedicine has made it possible for many of the office visits and so on to be done at home. I suspect this crisis will accelerate that trend, and I suspect there'll be a lot more desire and demand on part of us as consumers of health to seek care right at home without having to go to clinics and definitely to the hospital. So that's going to change healthcare dramatically. It's already changing payer behavior, how they reimburse for telemedicine, for example. I do think robotics and things like that will get a tremendous boost. But similar behavior you're going to start to see in case of education, for example. My 3-year-old who goes to preschool actually is having an online class every day for half an hour. And I know that K through 12 education is going through that. Stanford has translated completely all of our coursework into web-enabled sort of delivery of education. So my suspicion is there would be some sustained inclusion of these tools going forward. And I think we will probably start to do things in a much more localized and much more distributed fashion. Same thing with supply chain and manufacturing. We'll likely see a lot more robust in supply chain by sourcing a lot of our products from local sources, for example. So you'll see my guess is local economies may get a boost as a result of this. But we don't know. These are all conjecture on my
I know.
part, but I'm an optimist. So I think some remarkably good things would come out of it, I hope. At least we'll start to value things that we really should be valuing.
I totally agree. Let's talk about the shortage of supply of ventilators and PPE for our doctors and nurses, frontline workers. What's the story with that? I know that there's a lot of shortage in masks, and that manufacturing companies have ramped up and they're supplying masks and ventilators. What's happening with that? Where are we? We still have a shortage, it seems like.
Yeah, we do. I think we are overcoming that shortage. Just going back to the problem itself. Why did this problem come about? First of all, it's a black swan event. It's once in 100 years, right? We didn't anticipate. We didn't plan. We didn't necessarily. We were not prepared for it. I think we should have planned for it. We should have anticipated a crisis of some kind. But I think the scale of it and the speed of it really caught everybody by surprise. So from the government on down to individual health systems and so on, we were not really ready for it. So that's one part of the problem. The second thing is that a lot of our manufacturing of these technologies and these personal protective equipment have been distributed, and a lot of that exists elsewhere and is not accessible to us right away. So we don't have and we've operated fairly lean in supply of these things. So as a result, anytime there's a increase or decrease, a rapid increase in the demand for something like this, I think we should have anticipated that there would be a major bottleneck in the supply chain itself. And I think that's what we have seen, and because we have not been able to flatten the curve in a number of places, including Italy, including New York, that has been a challenge. We just could not overcome that deficit that we had. We could have done much better, going back to the point that we discussed earlier about having a global architecture to this. there is enough number of personal protective equipment, maybe not enough ventilators, but I think we do ventilators as well globally. If we really had a mechanism to coordinate amongst different nations, different states, different cities, different hospitals, very quickly through the use of technology, a way to sort of get an inventory of these technologies and an effective movement of these technologies using, airplanes and other things, we probably could have, avoided the severe shortages that we faced and that we still are facing to a certain extent. So I think both the fact that we are not ready at institutional levels, all the way to the societal level or healthcare system level, and then we didn't quickly turn around and sort of work with each other to supply these things or share these resources has been the problem. But we are seeing a kind of a light at the end of the tunnel because California was able to sort of flatten the curve. We had some excess, ventilators that our governor was able to share with some of the states outside. I think we shipped them to New Jersey, is my understanding, of 500 of these ventilators, and we sent some of them back to the national stockpile. So that's an example of starting to think about sharing of the resources across state boundary lines, for example. But we probably could do much, much better than that. And the other thing is that a lot of companies are ramping up the production. So my suspicion is within the next couple of months, we will probably have sufficient capacity to meet the needs that we have. I think PPE remains a challenge in many of the hospitals. I've been involved in enabling some of these, bottlenecking of the supply chain to move some of the PPE to some of the hospitals through the network that Stanford Biodesign has with global partners that we have. So some of them are friends of the U.S. healthcare system, and they've been able to send these things from Asia, and I thank them through this forum. Really appreciate their generosity and their willingness to support us in our time of need, and I assured them that we would be there for them if they need it.
Well, that's awesome. What are your personal feelings and emotions around this pandemic as a person? And it's important because there's a humanity side to technology as well.
There is, and in fact, this hits home literally and figuratively. And I hope we learn we take away some positive lessons from it. The fact that there's so many people have jumped in and become part of this in the community. Somebody actually has been stitching these masks, and we benefited from 5 of those masks. And I've tried not to take any of the PPEs from any of the access that I've had from the healthcare institutions because our healthcare providers need them. But these homemade masks do protect us, especially if you're staying home. I think that's more than enough. But there's been somebody in the community who's been making these and generously sharing with us. So it's remarkable what we have sort of done to come together and do. And then I hope that we never have to go through social isolation of this kind, because it's not. I worry about mental health crisis coming out outside of this crisis, on the other end of this crisis.
Yeah, I do too. That is a serious concern. And then there is unemployment, and small businesses are, some of them are shutting. And that brings me to the next question. This stress levels are high, uncertainty is high. What would you say to our viewers to calm their nerves? Any positive message, any silver lining that you see and can share?
Yeah, I think we should recognize that this is a serious condition. We are all at risk. It's very widespread, and it could kill us. And we have to protect all the people that we can. But it is not the worst thing that could hit us. Things could be worse. So I don't like to start with negative, but I do want to remind all of us, a bit of a context is helpful. The other thing is that we have tremendous knowledge today. We have amazing scientists, clinicians, engineers, folks that know how to address problems like these, diseases like these. So they are all working together furiously to come up with a solution to address this condition, and it will be defeated. I remain confident about that. So that's the second piece to remember. And third piece is that, rather than focusing on the problem, the uncertainty of the problem that we face, and it's becoming more and more clear as to what this disease really is, and that's part of the effort that you've undertaken through this forum to actually educate everybody that there's a lot more that we know. It's not as uncertain as you may be feeling, but that despite that uncertainty, the reality of your family being with you is remarkable. You're right there with them. When was the last time that you had this kind of time with your family? So, I would say focus on what you have in your hand, what has been presented to you. We are lucky to be alive. We are lucky to have resources that we do. There are a lot of folks who don't have these resources, and we're all working together to bring those resources to them. But those of us who have the ability to sort of bide our time and work through this, let's keep those things in perspective and make the best of the situation. This morning, I gave a talk to a group of high school students who are going through a 7-week-long program preparing for internships this summer. High school kids, internships this summer. They want to contribute to the future of our society, and they are willing to take the time to do this. And they feel optimistic about it. So we can learn from them. I think if they can do it, we can do it too.
Absolutely. And it's pretty heartwarming, as you said, to see the communities also coming together. I know of this in East Bay group of high school students who have, fundraised for PPE and been able to provide some 300 PPE gears. And so that it is pretty heartwarming how everybody is coming together. And we are very privileged, rightly so. Couple of quick things before we move on to my last question. Some myth busting things. What are the myths out there? Like I hear people are sanitizing their vegetables in dishwashers, and I know that some people feel better doing that, and that's fine. But just wanted to go over it from a scientific point of view.
Sure.
What are your thoughts?
Sure. I think our knowledge about this disease has evolved quite a bit. This virus has evolved, and just to acknowledge their concerns and why some of the people are going to an extreme is because they say things are changing so much all the time. We used to say that we don't need masks for the individuals, but now you're saying we should be wearing masks. And indeed, when there are a lot of people that are infected and there are a lot of asymptomatic people, when folks are speaking, they could be expectorating the particles that could potentially remain in the air for not just for a few minutes, but for longer duration. It depends on what size they are. So there is a risk that we have both from being around people who are not wearing masks, who may be asymptomatic but still may be infected by COVID-19, by the SARS-CoV-2 virus. So there is that risk. And there is that unknown that people are afraid of, and then surfaces can carry this virus. There's been a study that was published in one of the medical journals that just say that there are a number of surfaces in the lab, at least, that can, sustain this virus for several hours in some cases. This virus, but let's be clear about one thing. This virus cannot live outside of a human body. It cannot survive. It will, over a period of time, get destroyed unless it is a part of a living organism, sustaining on a living organism. So that's something to keep in mind. So if you have, let's say, a box of vegetable or a can of milk, even if it is layered with coronavirus, the novel coronavirus, if you leave it outside long enough, at some point it will be deactivated and it will not be infectious anymore. So let's just keep that in mind, right? It cannot live there forever. So there's a decay that's going on all the time. And yes, surfaces like vegetables can carry the coronavirus, but think about the source of that coronavirus, the source of the virus that may coat every one of these vegetables that you will need to actually disinfect every single vegetable. So my recommendation would be not to actually go to that extreme where you are actually putting that in the dishwasher and disinfecting it. I think if you just rinse it with water, at most maybe light soapy water, if the vegetable doesn't go bad with it, may be adequate. If you are washing these vegetables and then you're cooking them and you're washing your hands very well, similar to what we do when we do meat cooking, right? I mean, we do this all the time, those of us who eat meat.
The last question is, every hour there's some breaking news. Any reliable sources, your recommended sources that we can go to? That'd be great because you guys are at the forefront of the research here. So.
Yeah, well, yeah, I'm an information junkie, so I scour every single news story that comes out, even when I see that. So I think junk news actually interests me also because it tells me what the society is being bombarded with. Part of the reason we, created COVIDDB and why I joined the effort was exactly this, because I was seeing such a flood of information and not a curated source that really brought everything together. That was local, national, covering all over the world, different countries at both the national and the local level, right? But there are a lot of really wonderful sort of forums if you want to go for specific pieces of information. So CDC, for example, has a lot of disease-related information at the US level. FDA actually shares a lot of things about the things that are being approved today, for the new kinds of ventilators, multiplexing of the ventilator, devices and so on, which has its own challenges, by the way. So that's a good source. I do like the Johns Hopkins website, which is very, very popular for the metrics that they put out. It gets updated fairly regularly. Another one that I'm a big fan of from my global health days at PATH is IHME in Seattle. They do a phenomenal job of analyzing a lot of data. They are really, data nerds. So they analyze a lot of things and some wonderful, visualization of the data there. And then Facebook has an information clearinghouse as well. Stanford itself has a number of resources that you can use. But I think I would say COVIDDB brings a lot of them together. So if you're looking for one place, that's a place where a lot of these different pieces of information would ultimately come together. And if you are an information junkie like me and you want to contribute to it, you are welcome, because we need an army of people to do this. Because I suspect we'll need this portal for many, many, many months to come, if not for at least a couple of years.
My understanding is that it's like a Wikipedia for COVID, right?
Yeah, so it is. It does have that element where people are contributing, and it does bring a lot of publicly available information, and it is curated to a certain extent. Its architecture, though, is different from Wikipedia. It's designed. It harkens back to some of the older, earliest days of internet, where information was a lot more simplified and easy to organize versus the way we have to Google and there are pages and pages of that come out. And actually, the person who designed this entire architecture, Schumann, is actually was involved in many of those things early on. So this is his brainchild anyway. COVIDDB and Stanford students and others have worked on it. But I think that's so it is like Wikipedia, but it goes much farther than what Wikipedia can do. It's very real time, and it is designed to sort of for you to go and pick specific topics within that platform and go to information that is much more specific to your needs. So it's not a running list of information, but a categorized, tagged pieces of information, similar to what used to be like Yahoo a couple of decades back.
Wonderful. Thank you so much for your time and enlightening us over here today. I'm really grateful that you were able to participate in this and then give us your time. So thank you so much.
Well, thank you for having me, and kudos to you for creating this forum at this time of need. It couldn't be any sooner. This is wonderful. It is a lot of effort doing this remotely. So good luck, and happy to be part of this. Thank you.
Thank you so much.
My name is Dr. Evelyn Nakagawa. I'm a physician in the San Francisco Bay Area. I want to express my gratitude to Save Your Saviors Project for providing us with reusable biosuits and other supplies to the healthcare workers. These suits makes us safer and lets us focus on taking care of our patients. In fact, they've been shown to significantly decrease the infection rate for the people in the front line. With this gear, biosuits, masks, PPE, we can do high-risk procedures more safely and more effectively to our patients. We thank you for your generous contributions to Save Your Saviors Fund, which is saving people's lives, providing peace and ease for everyone. And from my inner gratitude, thank you very much. And from the behalf of the healthcare workers, we love you.